This training video will demonstrate the method used at Menlo Park Fire District to gain intraosseous access. There are many acceptable methods to obtain IO access, but having one method used by our personnel will eliminate confusion and streamline patient care. IO access is indicated where rapid, regular IV access is unavailable, the patient is in cardiac arrest, impending arrest, shock, evolving shock, or unstable dysrhythmia. IO access is contraindicated in patients with a fracture in the targeted bone, IO within 48 hours in the same site, infection in the site, burns that impact the bone integrity at the site, inability to locate landmarks, or orthopedic procedures near the insertion site. There are 3 sites that are acceptable for IO access in San Mateo County. Proximal humerus is the preferred site in adults only. Proximal tibia and distal tibia if it's the only suitable site. Proximal tibia is the preferred site in pediatric patients. There are 3 IO sizes that are supplied to us. Yellow 45mm for proximal humerus use in patients with large amounts of tissue over the proximal tibia. Blue 25mm for adults. Red and pink the 15mm for pediatrics 3 to 39 kilograms. Prepare the IO by flushing the tubing. IO gun should be tested before use. You should ensure that the correct IO size is attached properly. Do not remove the safety cap until ready to use. Prep the area using alcohol wipe and iodine if available. Next, we will show how to locate the 3 acceptable IO sites. For the proximal humerus, you will first want to move the patient's arm to expose the humeral head. You can do this by placing the patient's hand across their abdomen, placing their thumb underneath them, or rotating the arm inward towards the body. You will then feel for the bony prominence in the shoulder. It should feel like a golf ball on a tee. You can mark your target with the capped IO needle. To determine your angle of insertion, remember 45. A 45mm needle 45 degrees anterior and 45 degrees superior or aimed towards the inferior portion of the sternum. When inserting any IO needle, first advance it into your contact bone without activating the drill. The last black line should still be visible on the IO needle. Next, drill with firm pressure. For adults, you should advance until the hub is flush or touching the skin in most cases. In pediatrics, advance until there is a loss of resistance. Verify that the needle is firmly seated in the bone and it is unable to wobble. Next, secure the IO. You will then flush the IO with at least 1 flush. If the patient is conscious, you will be flushing with lidocaine, 40 milligrams, infused slowly over 1 to 2 minutes. You will then wait an additional minute before flushing. After flushed, attach a 1,000 milliliter saline bag and apply a pressure infuser. If there is still pain in the conscious patient, an additional 20 milligrams of lidocaine can be infused over 30 seconds. Make every effort not to leave an uncapped port on the IO, since this is a route directly into the bone. There is a high risk of infection. The IO kit comes with a wristband to indicate when the IO was applied. Fill this out and attach it to the patient. This will allow the hospital staff to use the IO longer if additional access is needed. There are 2 other sites that can be used for IO access in San Mateo County. They are the proximal tibia and distal tibia. The proximal tibia site is located on the flat medial aspect of the tibia, 2 finger widths below the lower edge of the patella and medial to the tibial tuberosity. The needle will be inserted at a 90-degree angle. For pediatric patients, the insertion site is about 1 finger width below and medial to the tibial tuberosity. An alternative site is the distal tibia, but this should only be used if the other sites are contraindicated. The humeral site is preferred in adult patients because it provides the quickest route for medications to enter the bloodstream and act on the heart. If the patient is conscious, keep in mind that the patient should not move the arm if you use the humeral site. This includes during patient transfers and movement, so the proximal tibia might be a more appropriate site. Thank you for watching. This concludes our review of IO.